Hi there, delighted to see you here on the Thrive Symposium. My name is Dr. Jo Braid. I am a brain injury rehabilitation physician and a coach for doctors. I live in Orange with my husband and my three gorgeous, energetic boys. And today I'm going to be talking about moving from burnout to balance. So I'm going to talk about some case studies and also an interesting concept I would like to share with you. And I will start off with telling you about my story in doing some additional subspecialty training. So when my youngest boy was a handful of months old, I decided to train in functional medicine. So a subspecialty that doesn't have a specific training route, and I had received some treatment that way and found it very beneficial, and I wanted to bring it into my clinic so I could offer it to patients here in Orange. I studied and I studied. I did at least 2 different training courses in the US and 2 in Australia as well. And whenever I finished an exam, I would look for the next exam to get. And I was getting rewarded by the external validation of passing the exam, getting through the 3 different exams needed to become recognized in that training program. It was exhausting. I was doing all this work after hours when the kids had gone to bed, at weekends when my husband was at home. And I was really striving for perfectionism within the work that I was doing there. It's a trait that's carried me through, or that's been with in my career for decades. I was looking for that gold star, and now, as I know so much more about myself and what I was really, what was underpinning going for these exams and getting that external validation, the perfectionism has crumbled into the ground for me. It is no longer something that I strive for. And in essence, it was preventing me from all I could be. So I'm going to use this flip chart here to show you a bit about thinking about what was I avoiding by overworking. So in essence, it was all that studying that then I was putting into the clinic, which also had an element of lots of preparation work needed before seeing the patients I was seeing in clinic. And really I had, once I had started coaching on how I was working in my medical practice specifically here in functional medicine, my underlying feeling was that I was not good enough. And that's why I kept on seeking external validation to prove that I was not good enough. But when I really thought about that and really worked on, well, actually, I have got quite a few qualifications, and I am good enough at what I do. It took a while to unpack that and reverse that and turn that around to realize that I had done a lot of training and I didn't need to do any more there. The truth of the matter is, though, I closed that practice earlier this year, and in essence, I definitely got burnt out and exhausted by what I had been doing in that practice there. So I want to talk to you a bit about how I have found medicine affects knowing what feelings are. So I have been 20 years in the game, and I remember getting told at medical school that you sort of have to get a thick, tough outer skin, and I know that I didn't develop that in medical school per se. I was in my first year in England as a junior house officer and was paged to come to the ward to certify somebody who had passed away on the ward. And it was very confronting. It was a very emotional time for me. I definitely hadn't developed that thick skin, but I went home and thought, geez, I can't have this happening every day, because that's, going to be exhausting and over-involved and so forth. And the barrier went up. Similar to the weight of a lead apron that you'd use in radiology, I numbed out from my feelings, and that lead apron idea was not only at work, but it was also at home. And I just was out of touch with my feelings and what was really going on for me. And I would say that could be a very common issue with people who are burning out or overwhelmed, exhausted, losing the joy in the workplace that they once did have before. And I work with my clients on really knowing what their feelings are. And that's an important way of knowing where your limits are, knowing what you're prepared to keep doing, or where you're actually going to say no and I can't give any more in that area. I would say that really understanding what is the root cause underneath, what is the reason why the overwork continues, can be a way to work out why the burnout has happened in the first place for the individual. And it can be different reasons for different people. Certainly it's not always the same reason why somebody develops burnout. So let's talk about a really nice little model that I learned from my coach, Maggie Reyes in America. We've got a very simple model here. It will be illustrated more in the next slide. So imagine you're a junior doctor in clinic, your consultant's away doing on leave, for example, and you've just got a new patient that's come in with a multitude of issues going on that's going to take a little while to unpack, as well as investigate and sort out. Your registrar has just called to say that they've got to leave for a family emergency that's just happened. The ward is paging you to get some medication set up before 4 p.m. because that's when the next medication needs to be given for said patient. You get a call from a family member to say that there's a leak in the house, a lot of rain going on, and we're going to need to get a plumber in or a roofer in to sort that out. In this short amount of time in an afternoon, there are a multitude of sort of need attention stressors that are happening both in the workplace, so in that medical situation, as well as outside of the workplace. And it is those external stressors that cause stress within your body. And today I want to share with you that day on day stresses that happen in your body, if that stress is not discharged, it then ends up affecting your hormonal system, your neurological system, your immunological system, your mental well-being. So how can we try and balance this circle here so that we're not living with these stressors and stresses within our body that don't get discharged on a regular basis? So this is called the compound stress syndrome, defined by Maggie Reyes. And here we've got some of those sympathetic nervous system reactions of fight or flight. There's also freeze and appease, which is like people pleasing and saying yes to everything. So I encourage you to think of what would be a self-soothing practice that you could have that would balance these stresses for you on a daily basis. Something that you can do at the workplace that could be as simple as 3 deep breaths with a longer exhalation than inhalation. That's very supportive for the parasympathetic nervous system. Talk to somebody you feel you can trust, you can confide in. Maybe go outside, get a bit of sunshine. That's always good for a workplace that can be so indoors the whole time. Sit down to eat a meal rather than eating it on the hoof. Maybe when you get home, you enjoy reading or you enjoy a soak in the bath. So you're communicating to your body, which is really communicating to your brain, that you are taking the time to release the stress from your body, and that it's safe for your body, again, rather than your body remaining on alert and remaining in a state of stress. So that you will have heard this kind of example before. You get on holiday and you're sick and you can't enjoy a really nice holiday by the beach, which you've been waiting for months, because your body is in that stress, and only then can it release, and you might get a cold or just be under the weather, so you can't make the most of that break. So making this a daily practice can really support you in that longer term. Self-soothing, that's the compound stress syndrome. Okay, and I would say that in the institution of medicine or healthcare, it's really important for you as an individual to take on this practice, because things are changing, definitely, but it's not a necessarily role modeled behavior within the institution that medicine is in, also in other workplaces. So if you can embrace that yourself and then share that with others, that's also a really great way to be supportive of the others around you, so that everybody has their own way that they are self-soothing and managing to get through the days, the weeks, the months, the years. Okay. So now I want to talk about a case study of a client I was working with, and show you in a way how similar coaching is to what we do in medicine. I was coaching this client. She'd had a busy week of work and she was home for the weekend, and she knew she could relax for a lot of the weekend, but she also had one work assignment due in Monday morning at 9 a.m. She was feeling really resistant to doing the work. So Saturday she enjoyed reading some fiction, she was scrolling on social media, she was watering her plants, maybe calling a girlfriend, not addressing the work at all. Sunday came around and that's her cleaning day, getting the laundry on, turning around her unit, and we were coaching, and she was just not wanting to do the 1 hour assignment that was essential for her to submit before Monday morning. So like in medicine, we're taking the history, doing the examination, doing some investigations to see what the cause could be for that persistent nausea for 3 weeks, for an example. I unpacked with my client what was going on for her and what was the root cause as to why she was not doing that work. She was worried she was not going to do a good enough job. That was her thought about the work assignment that she had. So she was feeling unconfident. She had elements of thoughts about imposter syndrome. So you might be aware of that when you feel somebody's going to find you out, that you're not as qualified as you, or you're not as good as your qualifications appear on paper, and people are going to see that your quality of work is not as good as you made out it could be, or so forth. So she was really, we were unpacking together what the underlying feeling was for her as to why she was procrastinating on doing the work that she had to finish before she went back to work on Monday. And her main feeling was that of, I'm not good enough. So not good enough is a common feeling that I've experienced, as I've already described with you, and many of my clients also feel that they are very judgmental on themselves. The inner mean girl or the mean guy can come out and be really tough on oneself, and that perfectionism again prevents progress. So by providing a safe container and a safe space for my client to know she was speaking in confidence, and that nobody at her workplace was going to hear about any of what was discussed in that coaching session, we could unpack the thoughts that had been holding her back from actions, and then she was the one that created the new thoughts that gave her a feeling of preparation or prepared to do the work, and ready to set some time aside to do that work and complete it, and then enjoy the rest of her weekend knowing that that work had been completed to a good enough standard to submit the next day. The client was really determining the outcome of the outcome of the work we did together in the coaching session. So much as with my clients in brain injury, they often have gait retraining to do. They've got to show up regularly for physiotherapy and hydrotherapy. They might have upper limb therapy or upper limb training to relearn skills, and again, regular sessions of occupational therapy or so forth, to unpack and change a thought and a feeling that has been with you for a long time in your mindset. It takes a while to relearn and choose those new thoughts that support you to complete what you're doing, or to move away from a style of practice that you've always done before that has led you into overwork. So we look at the circumstance together, which was the work assignment. We looked at the thought that she had about it. I'm not going to do a good enough job. Her feeling was resistant. Her actions were all the behaviors that stopped her from addressing her work, and the result was that she didn't address that work at all. And by changing the thought that she had about that neutral circumstance, so that's the work assignment to be done, she had a different outcome by changing the thought on that. Okay, so I have pretty well finished my talk here, and I would like to leave you with one last question. So what do I want to be different 1 year from now? You are in charge of your future. You are the one that has the thoughts that determine the actions you take and the results from that. So if it's going to be up to anybody, it's going to be up to you to determine what might be different for you 1 year from now. And then ask yourself, why do you want it to be different 1 year from now? I'm going to leave you with a worksheet that is attached to this video recording here. So you're welcome to have a look at that. That will have some more thought prompts as well as some more information. And it's been my absolute pleasure to be presenting today on the Thrive Symposium, From Burnout to Balance. And I look forward to hearing from you if you'd like to get in touch in the future. All the best. Thanks. Bye.